Mr. Speaker, this past Friday, Alberta Health Services confirmed the province's only publicly operated fertility clinic will stop offering non-insured services such as in-vitro fertilization in February. This impacts people across the province who want to grow their families and need support to do so. Services that help to find the cause of infertility are covered by the province, but procedures that attempt to find solutions are not. To the Minister of Health, why are there not more supports for families struggling with infertility in our province?
Good question.
Minister of Health.
Thank you, Mr. Speaker, and to the member for this important question. We know how difficult it can be for families who are trying to conceive when they are unable to do so, and that's one of the reasons why, Mr. Speaker, the space that will be created through the movement will focus on the insured services, just like counselling for families who are struggling with fertility and other publicly funded services that the member mentioned. In terms of the services that aren't under the formulary and aren't publicly funded, they will still be available in the City of Edmonton, but we are absolutely working at addressing the wait time and using the space to make sure that the publicly funded services have less wait, Mr. Speaker.
First supplemental.
Thank you. Given that existing patients must complete treatments by February or transition to other clinics, and given that many wait-listed clients are still weeks or months away from their appointments, and given average wait times can vary between 7 and 18 months depending on the clinic, what is the Minister of Health doing to ensure those already seeking treatment within the system do not have further delays due to the decision to end these services?
Good question.
Honourable Minister.
Thank you very much, Mr. Speaker. And we know it's extremely challenging to recruit to these positions, and I am being assured that the staff who are working with these patients will continue to do so and provide as many opportunities for them to receive the care in the timely fashion, particularly those that have already undertaken the treatments that they are part of, Mr. Speaker. Again, my heart goes out to anyone who's been impacted by this. I've worked to make sure that there will be a smooth transition for employees, because that is also something that we want to ensure that they continue to have opportunities to provide care and work, and that the insured services that are available continue to be provided through Alberta Health Services, Mr. Speaker.
Second supplemental.
Given that in February 2014, the Assisted Reproductive Technologies final report commissioned by the former government suggested public funding for ARTs could see significant healthcare and societal cost savings over the long term, and given that other provinces have a variety of options available, including unique funding models and tax credits, again to the Minister of Health, why is your government creating barriers for families struggling with infertility rather than supports?
Great question.
Honourable Minister.
Mr. Speaker, the member could not be further from the truth if she tried. Mr. Speaker, we are absolutely moving forward to expand access to publicly funded services. We are making sure that we're supporting families, and we are standing up for and protecting public health care in this province, as opposed to what members of the opposition are proposing, which is 20% cuts. Jason Kenney talks about a 20% cut, Mr. Speaker. We know that would do to public health care, and we know what it would do to these families, and instead we're supporting them, and the staff are continuing to provide important services under a public model where it's publicly available, Mr. Speaker.